Hello, welcome to Dental Notes and Mnemonics, and in today's video we'll discuss the classification of facial nerve disorders. The facial nerve is also known as the cranial nerve 7, controls facial expressions, taste and secretions like tears and saliva. So disorders affecting this nerve can be categorized in multiple ways. Let's simplify these categories step by step. Let's start with the etiological classification of facial nerve disorders. This refers to the causes and the origin of facial nerve disorders. Starting with congenital disorders, these are present from birth. A classical example is Mobius syndrome, where the babies are born with weak or absent facial movements due to underdevelopment or damage to facial nerve. Next, we have traumatic disorders. These results from physical injuries such as temporal bone fracture that can damage the facial nerve during accidents or even the childbirth trauma. Infectious disorders are caused by viral infections. Example include the Bell's palsy, where the inflammation of the nerve occurs, and the Ramsay Hunt syndrome, which is caused by reactivation of Varicella-zoster virus. Inflammatory disorders such as sarcoidosis or Guillain-Barré syndrome are caused by systemic or autoimmune conditions that lead to inflammation of facial nerve. Spastic disorders, tumors like parotid gland tumor or schwannomas can compress or invade the facial nerve, leading to weakness or paralysis. Systemic or metabolic disorders such as diabetes or hypertension can lead to microvascular damage that affects facial nerve. Degenerative disorders such as amyotrophic lateral sclerosis involve the gradual loss of nerve function over the period of time. Lastly, toxic disorders are caused by exposure to harmful substances such as alcohol abuse or poisoning with heavy metals, which can cause damage to facial nerve. Iatrogenic disorders refers to the condition caused unintentionally by medical or surgical intervention. In the context of facial nerve, these disorders arise from injury during diagnostic, therapeutic, or surgical procedures. The causes are the surgical procedures as in peridectomy, the local anesthesia injection near the facial nerve, trauma during intubation or use of retractors, radiation therapy for head and neck cancers. On the basis of the degree of the damage, the facial nerve disorders may be categorized into neuropraxia, which is the mildest form of facial nerve damage. It involves temporary impairment of the nerve condition, usually due to compression or mild trauma. Neuropraxia occurs in Bell's palsy, where the temporary facial weakness occurs without permanent nerve damage. Second degree of damage is exontemesis, where the nerve fibers are damaged but the surrounding nerve sheath remains intact. This allows the nerve to potentially heal, but recovery may take longer and may not be complete. Traumatic injuries to the facial nerve, like from the blow to the face or the surgical complications, could result in exontemesis. Then the most severe form of nerve injury is neurotemesis, where nerve is completely severed or destroyed. There is no possibility of nerve regrowing or recovering without surgical intervention. Severe facial trauma such as fracture to skull that directly damages the facial nerve comes into the category of neurotemesis. Based on the anatomical classification, the facial nerve disorders are classified as intracranial, middle ear lesions, and the extracranial lesions. Intracranial lesions such as tumors near the brain like acoustic neuroma. The middle ear lesions, which occurs in conditions like otitis media, and extracranial lesions often seen in parotid gland tumors affecting facial muscle movement. Now we move to peripheral facial palsy, which occurs when the facial nerve is damaged after it exits the skull. Common causes include the Bell's palsy and facial trauma. This condition typically results in weakness or paralysis on one side of the face. The next is central facial palsy, which happens due to damage to the motor cortex or its pathway. This type affects the lower half of the face more than the upper half, often seen in the conditions like stroke or brain lesions. Bilateral facial palsy occurs when both the sides of the face are affected, and this happens in the conditions like Guillain-Barré syndrome or infection that impacts the facial nerve bilaterally. On the basis of function, the facial nerve disorders can be classified into motor, sensory, or secretory dysfunctions. Motor function is one of the most common form of facial nerve involvement. It includes conditions like Bell's palsy and facial trauma, where the patient lose voluntary control of facial muscles, leading to facial asymmetry and weakness. Sensory dysfunction involves the loss of sensation, particularly in the areas supplied by the facial nerve, like the taste buds on the anterior two-thirds of the tongue. This can occur in the conditions like herpes-zoster, reactivation syndrome, or Ramsay Hunt syndrome. Autonomic dysfunction affect the nerve's ability to regulate glandular functions. Conditions like Frey syndrome can cause abnormal sweating, while others may lead to reduced tear or saliva production. Facial nerve disorders can also be classified by how quickly they appear. In case of acute onset, like Bell's palsy, it happens suddenly and often resolves without treatment. On the other hand, chronic disorders like tumors or progressive palsy develop and gradually and may need long-term management as well. Not all the facial nerve disorders have same manifestations. The symptoms depend on the factors such as cause, location, and severity of nerve damage. In case of Bell's palsy, the sudden facial weakness or paralysis, drooping of the face, and the loss of taste on one side occurs. In case of Ramsay Hunt syndrome, the facial weakness with a rash around the ear, pain, and hearing loss and vertigo is found. In case of trauma, the damage to the facial nerve from an injury can cause weakness in the face. Causes weakness in the lower part of the face, often on one side, and usually spares the upper face. While on the other hand, the toxic exposures can cause gradual weakness or changes in the sensation on the face. Manifestations based on the location. More severe symptoms like complete facial paralysis, changes in the taste, and the problems with the eye or the mouth occurs when the location of facial nerve disorder is intracranial. And based on the severity of damage, neuropraxia is temporary nerve damage which usually heals on its own. Symptoms are mild, like weakness that improves over a time. More serious damage occur in axonotmesis, but the nerve itself is not severed. Recovery can take time and physiotherapy may be needed. The most severe nerve damage is neurotmesis, where the nerve is completely cut. This requires surgery to fix and may result in permanent loss of function without repair. Compare Bell's palsy and Ramsay Hunt syndrome. Then Bell's palsy is sudden facial weakness, often with no known cause, affecting one side of the face. While on the other hand, Ramsay Hunt syndrome is similar to Bell's palsy, but also includes plain full blisters around ear, hearing loss, and balance problems. Treatment for Ramsay Hunt may require antiviral medications. If we talk about the manifestation of facial nerve disorders in stroke versus the peripheral lesions, then in case of stroke, only the lower part of the face is weak and the upper face remain unaffected. In case of peripheral lesions, both the upper and the lower part of the face may be weak on the same side of the face. In case where the facial nerve problem is of congenital origin, like Mobius syndrome, then the weakness in the face is present from the birth. While in acquired cases, conditions like Bell's palsy, which happen later due to factors like infection, trauma, or stroke. In case of facial nerve disorders, manifestation in toxic disorders Alcohol is long term alcohol abuse can cause weakness in the face. Poisoning from metals like mercury or lead can lead to facial nerve dysfunction. Conditions like Bell's palsy and neuropraxia, the facial nerve usually recovers over time. And conditions like neurotemesis, where the nerve is permanently damaged and may need surgery to repair. Manifestation based on the nerve branches affected. The first of all, when the temporal branch is affected, the forehead and the eyebrows are affected, causing them to droop. In case when the zygomatic branch is affected, it affects eye, making it difficult to close. Buccal branch affects the upper lip and cheek, making it hard to smile. Mandibular branch affects the lower lip and mouth, causing them to droop. And cervical branch affects the neck, causing problem with the neck movement as it affects platysma muscle. So this was all about the facial nerve disorders. Hope you liked the video. So see you in the next video. Till then, bye bye. Take care and don't forget to subscribe to the channel. Thank you. Have a nice day.